Touch the side of your jaw. Imagine one tooth starts throbbing tonight. It's just a small ache, so you go to sleep, assuming it'll probably be gone tomorrow. Then you wake up with half your face swollen. The dangerous part isn't the pain. The infection can spread into your jaw, then reach your neck. It can threaten your airway or enter your bloodstream. And without antibiotics, one bad tooth really could kill you. Thousands of years ago, people drilled teeth with stone tools. Mehrgarh sits in modern Pakistan. Archaeologists found 11 drilled molars there, belonging to 9 adults. The younger teeth were ancient, about 7,500 years old. The oldest approached 9,000. So how did anyone do this? Did the drilling help or make things even worse? Now, put yourself in the patient's place. On day 1, you chew on the other side. By day 2, cold water touches the tooth and pain shoots through your jaw. By the 3rd night, everyone else is asleep while you're wide awake, both hands against your cheek, quietly negotiating with the tooth. The tooth is not interested. A tooth looks like dead bone, but inside it's living tissue. Enamel shields the softer dentin. Deeper down is the pulp, filled with nerves and blood vessels. A cavity can open a root inside. So can a crack. Severe wear can do it too, and bacteria finally get in. Once the pulp is infected, pressure begins building inside a space that cannot expand. Soon, half your head hurts. The infection moves through the root, and an abscess can form in bone or nearby soft tissue. Your cheek grows. Eating gets difficult. Sleep becomes almost impossible. If the swelling travels deeper, it can reach your neck. Swallowing gets difficult. So does breathing. Now, this is bigger than tooth pain. Most toothaches do not end this way. Even without modern treatment, many people probably had pain that faded, teeth that eventually fell out, or infections that went no farther. But your camp could only guess which toothache would settle down and which one was turning dangerous. Ancient mouths weren't perfect. Food often carried hard particles that slowly wore down enamel. Seeds and tough fibers added wear, and years of chewing made it worse. Starchy foods existed before candy, so mouth bacteria could still feed on those carbohydrates. Researchers found ancient jaws with cavities, teeth lost during life, and infection damage around tooth roots. A damaged jaw proves there was injury. It cannot prove how someone died, but it can show the problem lasted. The damage had time to spread into nearby tissue. If you were the patient, drilling probably wasn't the first move. You might chew on the other side, clear trapped food, or use whatever dulled the pain. If the tooth loosened enough, someone might try pulling it. Every option carried risk. People could see the swelling, but the bacteria stayed hidden below the gum. Food became its own problem. When chewing became too painful, someone softened your food or crushed it. If pain kept you from your share, someone else had to cover for you. A skeleton cannot show that help. A healed socket proves one thing: the patient survived long enough for bone to heal. That doesn't prove devoted care, because that extra time remains unexplained. Then came the bolder option, reaching the damage inside the tooth. Mehrgarh's holes came from flint tips so small that a bow drill probably turned them, using the same technology as bead makers. That skill could cut hard materials. Maybe someone aimed it at a tooth still attached to its owner. Now, imagine the procedure. No X-ray showed the damage, so its exact location was unknown. There was no modern anesthetic. The patient had to stay still while a stone point turned against enamel. Perhaps a helper steadied the patient's head, but no record explains exactly what happened. Tests show flint can cut enamel, so the tool itself could work. Why they drilled each tooth remains unknown, along with how much pain it relieved and how many patients developed complications. No filling material survived in those teeth. Drilling may have opened damaged tissue or released pressure. It could also crack the tooth, cause bleeding, and create even more pain. Bacteria could use the new opening to travel deeper. The promising solution created new risks. That makes this more than prehistoric horror. Maybe the operator wasn't a healer, but a bead maker. Someone with steady hands, a tiny drill, and experience cutting hard materials. An old skill met a new problem because every other choice was limited. If drilling failed, nothing good remained. Leave the tooth and hope the infection stops. Pull it and risk injury or bleeding. Wait for it to break, fall out, or drain on its own. They had no tested treatment plan. They watched the patient's pain, the swelling, and the patient's overall condition, then chose the most survivable risk. What happened afterward mattered just as much. The tool was only one part. The patient still needed water, food soft enough to swallow, and time away from normal work. Bones show that some people survived and healed, but they cannot identify the helper, the food, or exactly why the patient survived. Before dentists, one tooth could kill. Not every cavity was fatal, but infection could start inside one tooth and spread somewhere far more dangerous. There was no miracle plant or perfect procedure. People cleaned, pulled, drilled, waited, and when help was available, kept the patient going while the body fought the infection. If your tooth starts throbbing tonight, you don't have to wait for swelling. You don't need a jewelry maker or their drill. You can see a dentist instead. That profession exists because people kept solving this problem for millennia. 9,000 years ago, a patient may have watched it approach. Then came a familiar instruction: stay very still. Once you see the old options, the modern dental chair feels much friendlier.